Okay, so I have 1:15 straight up. We will go ahead and get started. Welcome everybody to our weekly news briefing on all things regarding COVID-19 in the city of Bloomington, Monroe County, Indiana University, and Indiana University Health. I'm Chuck Carney, Director of Media Relations for Indiana University. We will start with some opening comments. We'll start with Mayor John Hamilton.
Thanks very much. Good to be with everybody. I will give, as usual, the quick updates on city stats. We have had 3 employee cases this past week. That's up significantly. We haven't had that for a number of weeks. Of course, that's anecdotal from our own employment, but reflecting some more spread happening. And I can also report on the City of Bloomington utilities. The regular wastewater testing also indicated significant increase in the detected gene copies. As you know, they check the wastewater at our 2 wastewater plants, north and south. And on the south plant, the larger plant went from 79 copies per 100 milliliters to 160, so about doubled in the last week. That's just kind of one indicator of background, how much virus is around in our system. And the north wastewater plant went from 28 copies to 35 copies. So also an increase, but not a doubling. Just a reminder that little piece of data is something we continue to watch, and both of those went up this week, as did our employee case number. We just nosed ourselves over the 70% of our employees have now demonstrated their vaccination status. 650 employees vaccinated, just over 70%. We're pleased that keeps moving up. And the last note I'll make this week is we are continuing to work very hard on the new Occupational Safety and Health Administration standards. Have demanded a lot of attention to prepare for that requirement that large employers like us have regimes in place to assure vaccination of all our employees, or regular weekly testing and other masking protocols. There's, of course, some litigation going on about that nationally, which makes our own lives more complicated. We view this as a good step forward, the right thing to do, and we're preparing for it. There's a December 4th and a January 4th deadline, but it's complicated, and also we know the testing access will be difficult. So we know we're not out of the woods. We know we're headed into colder weather and more family gatherings. So the concern is very real, and hope people will continue to take the steps needed: vaccinations, boosters, flu shots, and distancing and masking and being careful, because we definitely have the Delta variant still among us. And I'll hand it back to you, Chuck. Thanks.
Okay, let's next check in with Monroe County and Penny Caudill.
Good afternoon. I want to get right into where we are today. The current public health regulation requiring masks indoors in public places, regardless of your vaccination status, does remain in effect. The Board of Health met last night, and with cases increasing, they decided to not make any changes to the regulation at this time. So we will be staying the course in hopes that we will reach the goal that we have for low transmission. The regulation will remain in effect until community transmission is at a moderate to low level, which means that cases are less than 50 per 100,000 residents, and county advisory level is in the blue. And I want to recap the last month. On October 27th, we had 92 cases per 100,000 residents and a positivity rate of 4.31%. And everyone, we were looking and hoping to see that blue advisory coming and the level of transmission continuing to drop. But since that time, cases have been on the rise. Transmission has been increasing. And this week, we saw 123 cases per 100,000 residents and a 4.6% positivity. So we remain in a yellow advisory. Today, our daily cases, that rolling average is at 37 cases a day. It was this time last year that we went from yellow to orange, and we are traveling in the wrong direction at this moment. And the other thing that I really want to stress today is the rising number of deaths that we have seen in recent days. Since October 18th to today, we have had about 17 deaths, one per day almost. So our average, or that rolling average, is about one per day. So it's not been, completely one every single day, every other day perhaps, but we are seeing way too many deaths. And for those who might be saying, well, death occurs in people with underlying health conditions who are older, I want you to look at the age ranges of people who are dying, and they are getting younger. Not just in Monroe County, in the state, Indiana has seen at least one death in every age group. So we don't have to let that happen. Let's stay the course, do our part to get out of this. If you are in need of testing, if you've been exposed, you have symptoms and you need testing, the Gravity site that the State Health Department funds is on the east side of Cook property now. It has moved from that backside on Profile Parkway to Curry Pike. It is 301 Curry Pike, and it's the old GE plant. So for those of you who've been around for a while, that's where that's where you go in. It is at Jonathan and Curry Pike. It's a little bit tricky to get in. There's one lane that's in and out, but once you get in, follow the cones. It will take you up to where they are doing the testing. Stay in your car. Staff have access to the indoors so they can stay warm when it's cold and people are not there needing tests. They will come out, they will get your information, and they will take your test. So that is an option for you. We have a mobile site. Indiana University is gracious enough to provide location off 10th and the bypass. And they came on Wednesday and they are there today and tomorrow, noon to 8 p.m., doing vaccinations and testing. So with whatever you need, hopefully you should be able to get it. On a positive note, we had our first of 2 super shot school clinics yesterday, 5 to 11-year-olds. We were at Richland Bean Blossom last night and did almost 300 vaccinations. I think the exact number was 281, but nearly 300. So those appointments have filled up very, very quickly. Tomorrow, our nurses and volunteers will be at Monroe County Schools Corporation, taking care of the people who made appointments for that. And so we're excited to be able to give those children their vaccination and a greater sense of safety as they move towards being fully vaccinated. So far, the interest in those on-site school clinics that will also be coming is very high. We had one school that's already submitted their consent forms, and there were over 100 of them. So that, the 12 to 18-year-olds, there wasn't a lot of interest this fall. I think we got them early, but we are seeing good interest now. So we will continue to meet the needs of our 5 to 11-year-olds. And we're very, very excited to do that. Flu clinics did conclude in our schools, and so we are focusing our efforts now on those younger students. For people with questions, Dr. Talukian is on our Board of Health. She's a retired pediatrician, and she will be hosting a virtual town hall discussing COVID-19 vaccinations for children on December 1st from 6 to 7 p.m. And I've got a little information I'll share with you here in a minute. Pediatricians, Dr. Laughlin, Moore, and Simmons will be joining her, and they will be answering questions that people have. And I'm going to put a link in the chat where people can go ahead and submit their questions early so that they know what people want to know. And they will take their questions on December 1st. So be looking for that. We will be sharing on social media and our webpage. We will have the flyer for that out at the first of the week. So people will have all those details, but I will send that link shortly. We do expect CDC to approve boosters for or for 18 and older soon, probably as early as later today. But our primary focus in the clinic right now is remaining on those who are unvaccinated. Ourshot.in.gov gives you all the vaccination options. So whether you need a booster or your first dose or your second dose, you can get information about how to do that. Our Miller Drive Public Health Clinic is open most days, including Saturday. And that's our big day where we can usually take some walk-ins. However, I want to make note that this Saturday, because we're also at Monroe County schools, there will be no walk-ins at the Miller Drive Clinic this Saturday. And lastly, flu season is here. Vaccinate sooner rather than later, and that is in your best interest. Vaccinations, masks, hand washing, isolation and quarantine as appropriate are all steps that we can take to keep yourself and your family safe this winter season. Back to you, Chuck.
Okay, let's check in with Monroe County Commissioners and Penny Giffens.
Good afternoon. I want to let everybody know that we continue to provide money through the township trustees for people who are struggling to pay for rent or mortgage or utilities, or even in some cases, medical bills. We want to make sure that people stay housed. With the support of County Council, at this point, we've provided $150,000 to our residents, and every resident of Monroe County lives in a township. You can find your township trustees' contact information either at the minutes from the Monroe County Commissioners meetings or at the emergency management webpage at co.monroe.in.us. As with the city of Bloomington, the county is also looking at how to implement the new federal OSHA guidelines after they've gone through some of the court challenges to this. And so hopefully we'll have something that we can share with everybody in the not too distant future. And I'll just echo what everybody else has said. Please get vaccinated for both COVID and for the flu. Wash your hands, stay apart, and isolate if you're sick. So thank you.
Okay, let's next go to IU Health and Brian Shockney.
Thank you, Chuck. Thank you, everyone, for being here today. We are continuing to see a lower but steady volume of COVID-19 inpatients here in the South Central region. And then the numbers between IU Health and Bloomington Monroe Hospital, it's the same. As we've stated, this virus is deadly to the unvaccinated. Our mission is to save lives and improve the lives of those living with this disease. We need you to help us. Help us fulfill our mission by getting vaccinated, wearing a mask, remaining socially distanced when necessary, and practicing good hygiene. We do have concern as the mayor, and as Penny stated, we have concern about what's going on with this COVID-19 vaccine in our communities right now. We also are concerned as healthcare providers and community members with the flu. And as I've shared through the last few press conferences, flu cases are another concern that can contribute to potential inpatient numbers as well as other illnesses. We are continuing to see increasing numbers of flu, that's the influenza in our region, in inpatient, emergency department, and outpatient settings. So while the start of the influenza season does not necessarily indicate the severity of the season, the influenza season appears to be starting earlier this year than it has in the last 5 years. In 2016, we saw only one influenza case in our region in the month of November. And as of today, we have seen 93 cases in our inpatient areas. In the last 7 days, 96% of the isolates collected were from patients under the age of 23. And while the numbers are not large currently, we're still seeing inpatient admissions as a result of this seasonal influenza. So flu vaccines are available at most of your pharmacies, primary care offices, along with your COVID-19 vaccines. We've said it several times. I've heard Administrator Penny say several times, you can get both at the same time, and we can do that. Please see your IU Health provider to do that. If you have an IU Health provider, and you can sign up to see them during your normal visit. Please get your vaccines as soon as possible. And then I want to wish all of you the best for your Thanksgiving holiday. Wherever you may be, stay safe, protect yourself and others by wearing a mask in public, social distancing, know the vaccination status of those you are celebrating with, and washing your hands regularly. And as we head into this Thanksgiving next week, we should pause and reflect on those things which we are truly thankful. I know we're thankful for each of our colleagues on this call that have made this pandemic and this last surge a surmountable mountain, as with their support and service to ensuring the best outcome for our community and our county. I'm also thankful for the media and their continued engagement in getting the word out to the community and the county. And I'm also very grateful for a vaccine that has placed us in a better place this year at Thanksgiving than we were last year at Thanksgiving. So thank you for those who've gotten vaccinated, for those who are now getting their children vaccinated, and most thankful for our healthcare workers at IU Health and our first responders that provide care despite their weariness with this pandemic and the planned move to our new facility in the next 2 weeks. Everyone have a great Thanksgiving, and I'll answer questions.
All right, let's next check in with IU. We'll go to Aaron Carroll and then Kirk White.
I think, what we're seeing mirrors what's happening in the rest of the state. COVID is on the rise. And so we're watching everything, and we're still continuing everything that we are doing. And the numbers still remain, very manageable, but it's not decreasing week over week as it was some time ago. Of course, students are really going home next week for the most part. And we'll have to, monitor as things restart up back as they return and as we move into December. But it's getting colder. People are spending more time inside, and the numbers across the state and in much of the region appear to be heading in the wrong direction. Of course, flu, as many of others have noted, is also a real concern. We're seeing significant cases of flu, and of course, even though students are vaccinated against COVID, that doesn't mean that they're immune from all diseases. And, too few are still vaccinated against flu. We're therefore working to try to get as many people vaccinated as possible against flu, as well as, trying to scoop up the remaining people who still need to be vaccinated against COVID. But we're, again, knowing that we're going to be on somewhat of a pause next week. We'll just have to be ready as students return to continue to watch both these illnesses as we move into December.
Thank you, Dr. Carroll. Appreciate the overview there. And just for the statistics, our vaccination rate at the Bloomington campus has ticked up a few tenths of a point. Again, this week we're up to 94.6% overall. But as Dr. Carroll mentioned and others on the call, we are seeing a difference in the trend line on COVID. This week, we increased the number of COVID cases to 51. That's up from 35 the week before. And this is really the highest prevalence we've seen it since late September. So the trend line is going in the wrong direction. So we need to be mindful of that. It's, as Dr. Carroll said, it's still very manageable and relatively low numbers compared to where we've been in the past, but going in the wrong direction. And 40 of those cases were students. So we will continue our mitigation testing as the students, of course, are departing. But as Dr. Carroll mentioned, we'll go back to the full testing operations upon return from Thanksgiving break. And then discussing flu, we have seen a significant increase in flu cases at the Bloomington Campus Student Health Center. Though the increase is there, and perhaps not as challenging as COVID, if you get that, it's still a big public health problem. So we still want to encourage everyone to get a flu vaccine as soon as possible. There's plenty out there. We have plenty of supply at the IU Student Health Center for students, faculty, and staff. And encourage you to make an appointment, come on by and get a flu vaccine. I'll put the link there so that you can get more information about it at our Bloomington campus or at our other campuses around the state where we have vaccine available as well. So that's our update for this week. Ready for any questions?
Okay, and still waiting for our first question as we get ready for that. Penny, I'll ask you again to emphasize the information regarding the clinic that is going on at outside the Smith Research Center on the IU campus, which is just off the bypass, so geographically off of 10th Street. I know people, that would be me, who are getting a booster there tomorrow. So you might emphasize what that information is.
Certainly. So it is at Smith Research Center parking lot. I've got the address at 2805 East 10th and the bypass. They are there noon to 8 p.m. Today and tomorrow. You can go on ourshot.in.gov and find that facility as well. You can, if you need testing, you can go on the coronavirus.in.gov testing and find that. My understanding is they are also taking some walk-ins as they are able. So if you can't get an appointment, you might try just driving up in there as well and see if they can take care of you. I do not know how much flu vaccine they have, but I know that they were going to try to have some flu vaccine with them as well. So not certain about that. I would say if you have an appointment for a COVID test or for your vaccine, then if you need a flu shot, ask them if they have that available. But we encourage everybody to use that site. And we will request these mobile sites in the future as well. We've had several of them here in the county. We want to use all the resources we can to bring opportunity to our community to get vaccinated or tested, whichever they need.
Question from Dave Askins, the B Square Bulletin. The County Board of Health yesterday voiced some criticism of the lack of masking at IU basketball games. Does IU consider the county mask mandate to apply at Assembly Hall, and what is IU doing to enforce it at Assembly Hall? Aaron, I'll pitch that to you.
Yeah, I mean, absolutely. It's in Monroe County, and we absolutely are part of the county and consider it to be part of the mandate. As you can imagine, it is difficult to patrol and police something of the size of Assembly Hall. Lots of people who attend games are not from Bloomington or from Monroe County, and therefore are used to different restrictions. We have an enormous amount of signage. We are constantly asking and notifying that people should mask up. And we're, recognizing that it is certainly nowhere near 100%, and we're continuing to push for better. We get it. We're reevaluating what we can do to increase it. We're working as best we can with everyone else to do it. But we absolutely do consider that to be part of the mandate.
And Chuck, I just add that to Dr. Carroll's comments, it is it's a concern, and we've been aggressively trying to educate the fans at Assembly Hall of the importance of having a mask on. Pre-season and pre-game, we send emails to all of our season ticket holders to let them know that there is a mask mandate in Monroe County, and that does impact and is an effect at Assembly Hall. We do have signage at all of the entrances, just like we do at other campus buildings. And in fact, we've even tried this innovative approach of having our event staff walk up and down the aisles with signage reminding people. Unfortunately, some of those folks are getting verbally abused as they try to present this positive message of reminder. So we really do encourage our fans to be part of the public health solution here and help us in mass at this and this where everyone wants to enjoy an athletic event. We're not alone in this. If you look at athletic events that are indoors now, perhaps at local schools, high schools and other venues, they're having the same kind of problems we are. And so we're kind of working our way through this for the first season, since we didn't have a lot of this last year, particularly indoors, we did not. We even think that there's some mentality that may have transferred from football. I mean, you're in an environment like this and you're outdoors. not quite as close together. The outdoors doesn't seem quite as risky. You get into that groove and then you kind of transfer it to Assembly Hall. So we continue with public address announcements. At the last game the other night, we distributed between 3,000 and 4,000 masks as people arrived because they just didn't have them, or they don't think they need them anymore wherever they came from. I would say that as well, we've really been impressed with the way the students are behaving on campus and even around the edges of campus. So this seems to be an athletics related mass type of, they just get caught up in the cheering and the excitement of Assembly Hall. I just left a restaurant on Kirkwood. Everyone in the restaurant that was in line and not eating, and all the staff were all masked up just like they should be. And that's great. And not just for COVID, but right now for the flu, it's a great thing too. So we're going to keep at this. We don't have all the answers right now, but we're going to keep at trying to explain to the public why this is an important public health measure that they ought to be taking.
And just a quick note, Aaron is going to be hard out at 1:45, so he'll disappear from the call here in just a moment. Dave asks a follow-up if we would consider getting a mask cannon to shoot free masks into the crowded Assembly Hall the way T-shirts, sometimes hot dogs are. I think the problem there is actually weighting. The T-shirts and the hot dogs have a certain amount of weight, masks don't. It'd be hard to make that thing fly.
But Chuck, we could wrap the hot dog in a mask.
In a mask. There you go. Yeah, it's a T-shirt combination mask. But but Kirk does point out that we do those things are available. I walked in the other night with someone who didn't have a mask and went immediately and got one. Just simply forgot the mask. So it is available, and we do have those there. Next question from Brock Turner. Of the people who have died since October 18th of COVID, how many were unvaccinated? Penny, I'll go to you on that.
Yeah, I don't have that specific information, but what I can tell you is that in recent weeks, less than 5% of hospitalizations have been in people who were vaccinated. So again, we've said this repeatedly, the vast majority of people who are being hospitalized and who are dying are unvaccinated.
So from Eric Berman from WIBC, two questions for Penny about vaccinations for ages 5 to 11. Is the county's vaccine supply for that age group adequate for demand, or is there a risk of turning people away and long waits? And also, how does demand compare to when 12 to 15-year-olds became available?
Sure. So supply right now is flowing. It is as much about the ability to schedule those appointments and meet that demand as it is about the supply. We don't make appointments if we don't have vaccine that is on its way or already here. So that is sometimes why appointments are not booked out into January or February or something like that, because we want to make sure that if you have an appointment, you will get vaccinated. So first and foremost, that's really how we're dealing with it. And doing the school clinics is another way to help us regulate, make sure that we have enough vaccine for that next clinic that's coming up. In terms of demand, every time that we have opened up a group for new eligibility, the demand is high. And exact comparison, I don't know that I can make an exact comparison other than to say that the demand is high right now. It's a new group that's eligible, and we've seen high demand every time we've had a new group that's been eligible. My hope is that it doesn't wane. Typically we've seen that surge of new people eligible, and people want it and they want it now, and then it kind of wanes off. I want us to get all of these 5 to 11-year-olds vaccinated. So I hope that the demand continues until we reach that level.
We're going to squeeze in one question that will have Dr. Carroll on it, and we'll also go to Brian. This is from Eric Berman again. How concerned are you about Thanksgiving gatherings worsening the current wave with vaccinations and people already out and about? Does Thanksgiving pose a significantly increased threat?
Well, it depends, of course, on who we're talking about and how they're handling Thanksgiving. If it's a gathering in a house of all vaccinated people who have been relatively careful, then it doesn't pose much of a danger at all. If it's huge gatherings of people, some of whom are vaccinated and not, and or perhaps the majority are not vaccinated, then of course it's very unsafe. Of course, testing would help make it even safer, but that's not as easily available as we would always like. But it's important to remember that there's nothing special about the day. It's just the idea that many, many people might be gathering who are otherwise not, and doing everything you can to still be very safe in that kind of environment is a good idea. But again, just as people are dining out right now, even though there's rising cases of COVID, the idea that we might get together in individual homes, if everyone's being careful, could still be very safe.
Chuck, I'll answer that as well. Thank you for the promotion. I'm not a doctor, but anyway, so from our perspective and my personal perspective as well, know the vaccination status. We're 21 months into this. There is no harm in asking the people that you are dining with, that you are communing with, that you are eating with, that you are gathering with, their vaccination status. And there is no harm in asking them to wear a mask and asking them to refrain from Thanksgiving gatherings if they have a temperature or any symptoms. You're protecting yourself, you're protecting your loved ones, and your guests. The last thing I would want is someone to fall ill from being at a family gathering that I either was a part of or that I sponsored or supported. And so I think we're beyond this need to protect each other from asking questions. Let's ask the question and let's do the right thing after we get the answer.
Okay, I will give it a moment for another question here as we still have a little bit of time, and I will throw in that I have thought of a solution here regarding the mask cannon. So there is at a certain point during every game a drop from the rafters of Assembly Hall for a certain chicken chain, let's put it, where they give away free prizes and they have little parachutes on them. I don't know why those masks wouldn't work for that. And seemingly that might be able to get those parachutes to come in my direction, which never, ever happens when I'm at a game at Assembly Hall. But that clearly is because the fix is in regarding my eligibility for sure. So not seeing any other questions, we may leave it there and remind you that we will be back in 2 weeks again to do this, as we're doing this now every other week, and give you an update on COVID. We wish everybody a great Thanksgiving, and we will leave it there and see you in a couple of weeks.